It's so.
Obviously, it's like a freaking
They're running it.
recording of this guy.
It's like running from balls.
like Sonic the Hedgehog away from a freaking drone strike. And it switches.
Yeah, it's like a.
It's so
Teenage
weird.
joke. Oh
Dude, imagine how scared that guy
my god.
He's like,
Oh. Ah, ah.
phones up. Yep, I think we got it right now. So please welcome Behavioral Medication and Minors Group.
Good afternoon, everybody. I'm Thea Robertson, and today our group, Trey, Taylor, Leah, Amber, and Matthew, will be presenting our grant proposal for behavioral medication in minors. We are asking for a grant for further research in a healthcare facility for focusing on art and music therapies. So I'm going to go ahead and give you a brief description of the history of behavioral illness. One of the earliest explanations for behavioral illness was supernatural disturbance, and our scientific understanding expanded in 400 BC when Hippocrates separated superstition and religion from medicine, and continued to expand in the 1800s and 1900s with new innovative medications and therapies. This is an important topic in biotechnology today because of the adverse side effects that some of these medications pose on patients. And innovative therapies offer an alternative to these medications, as well as an effective cure for some major illnesses such as depression.
Okay, the largest contributor for behavioral medication is the FDA, the Food and Drug Administration. They regulate all medications for the public use. This is important because depending on how well they do their research, might determine how many side effects they find, which could later determine how safe somebody is taking it. But the problem with that is they can really only do short-term medication research because for long-term, they would have to observe somebody's entire lifespan, which would take way too long. Another organization is the National Council for Behavioral Health. They provide screening, care, and treatment for anybody with a behavioral disorder that needs it. And they do use some alternative treatment, but not as much as autism speaks, which is basically National Council for Behavioral Health, except they specialize with autism, which allows for them to do a bunch of alternative treatment like diet remediation and heavy metal removal of blood, which is thought to be a cause of autism. So, and in terms of public awareness, it's National Autism Awareness Month. So
As Taylor talked about with the side effects and long-term effects not being known with a lot of medication, it's important to consider alternate treatment. With opening a health center, it would provide art and music therapy that didn't concentrate on medications as much, so there's less risk for overprescribing, and it also uses alternate treatments that are proven safe and effective. A health center would also provide access and allow lower income or families that don't have as much access to traditional methods of treatment to gain access and help.
So what we would like to do is we would like to what we
NBD.
So what we would like to do is we would like to open up a medical center. What we would conduct here is we would conduct classes on how to treat children, or excuse me, how to help manage children and what to be on the lookout for in kids with behavioral conditions. Um, as previously mentioned, art and music therapy will be a big part of it. Art and music therapy has been proven many times to be an excellent alternative treatment for behavioral disorders. This center will be looking to get away from medicine and mostly just focus on alternative treatments, as many studies have shown that behavioral medicine, such as Ritalin and other medicines of the sort, can actually cause some long-term damage to children behaviorally and physically.
So, our plan is to open a medical center and an office to treat the children who have the issues, but to also open a class up for the parents how to treat the kids at home. Because yes, you can go to a physical therapy site, but the physical therapist also teaches you how to use your equipment at home. So we plan to do the same thing for our music therapy with the parents, because the parents struggle with dealing with the depressed teens at home as well. We also plan on opening a laboratory and talking with the FDA about prolonging and allowing the long-term studies of medications and art music therapy to be concluded, because right now there's very little information known about long-term effects because minors do not have legal right over themselves. So the FDA is very strict on rules that are allowed for the teens to have long-term effects studies done. So our total cost we're asking for from you guys is $250,000, but in total we need $420,000, and we'll be getting the other amount from the National Science Foundation, which will help us a lot studying for the long-term effects of the medications and treatment, and with helping the children with depression cope.
So to kind of go over what all has been said, your money that we're asking for, the 250,000, would go towards the center, but also the things going on within the center, such as the classes and the scientists, teachers, the people to help the kids with the music and art therapy. But the reason we're not researching medication is because medication could also make it worse. But because we want to use something safer, and we won't have to go through all the approval of different companies with the medicine. So overall, music and art therapy creates happier lives, equals happier families.
Questions? Teacher?
So, can you talk to me about what music and art therapy, what do we know about it, what does it look like?
There's been one study done with 24 depressed teens split into two groups. One group didn't get treatment, and one group got treatment over a course of several weeks. They listened to 3 different types of music: exhilarating, sad, and rejuvenating. And it helped them be able to express themselves in a non-harmful way and help them learn how to cope with their disorder of being depressed. It also, there's very minimal studies done on it because it's so new and so controversial to some of the other treatments, because many doctors overprescribe medications just trying to get through most of their clients. They just say, oh, you're depressed, here, take either Zoloft or Prozac, which are the 2 most commonly prescribed among teens. But they have some really nasty side effects, whereas art and music therapy don't have really
any side effects except maybe lifting it. Okay, so what's controversial about this? First of all, where does the study take place? Who did the study? The study takes place in, is it unknown, but I know it's what's controversial about it? Many parents are very skeptical due to the limited information, so they don't want to put their teeth. They'd rather get a known drug than do something experimental with it. So there's a lot of arguments whether it would be good for the kid or bad for the children.
The gentleman in the center made a comment about how it was proven that art therapy was successful in treatment.
In some of the cases, art therapy is proven, but in some of them they're not. It is not constantly proven to fix it.
Well, how many studies have been done?
Well, pretty much what Amber has said, in many cases it has been proven to work better or work almost as efficiently. There are, of course, some cases in which they do not. And Amber has done most of the research regarding art music therapy in her research paper, but she is certainly more knowledgeable of it than myself.
So Amber and I both did or centered our papers around art and music therapy, and on the website we have the links to the citations, and we given data and information to back up everything that we've said about art and music therapy. There has been a study conducted in with a group of children to see how art and music therapy affects their illnesses, and the data on that is. Yes, ma'am.
Are you just referencing that one study, or have there been others?
I'm sure there have been others, but when we were at UVA, that was the most prominent study that we found.
So can you go back and answer my question about so besides listening to music, so you talked about music therapy, so if I want to give you my money, I want to know what that's going to look like in this health center. So I understand that you got some research going on, and I understand what that looks like. What are these kids who are behavioral problems going to be doing?
So in the experiment that we found, kids were sitting in.
No. I don't want to know about your research. I want to know what
Okay.
you guys are going to do
Okay.
with my money.
We are going to have these children come in and sit basically in a room with other kids and sit for long increments with music playing and allow themselves to express any kind of art they want to. And this basically integrates art and music into their beautiful assessment and allows them to have both of these different types to help them during.
Back here.
Would just having them in a room with music playing while they're doing art hear them alone, or are you going to be doing other things? That's why we're doing research first.
At the center, there's going to be more than just putting them in a room. It would be more like there's also a staff therapist or scientist as well that help them along or give them certain cases individuality as well as assessing children. It's not just like grouping them together.
One more. Sorry.
Did you account for the center and all of these, I guess you could say medical professionals in your budget?
Yes, we did.
And that's going to be within $250,000.
No, originally we estimated that it would be around. We originally estimated for it to be around $420,000. We're only asking $250,000 from you guys, $250,000 from you guys, and then the National Science Foundation is going to help us out a lot by donating, and we have other random donators that might want to donate to the cause.
How are you going to get that money?
Through donations of the National Science Foundation, as previously mentioned.
No, but like, how are you going to get them to give you the money? They're not just going to throw it at you.
They're gonna get this presentation.
Got it.
Why do you laugh like that, Rach? Is that cheddar popcorn? No. It's lightly salted. It's olive oil. Lightly salted. Pretty good. Wow. Is that lightly salted?
Talk amongst yourselves.
Are they the last group? Are they the last group? Darn.
Yeah, after this.
You should order like that at Papa John's, like, oh, let me get ice cream cone, please. Dang, she's short. I should not really laugh.
Yeah, you did.
I'm not that short. I was the tallest person in my group.
Pardon? Okay.
Yes. You want to stand up right now? Hey, look who it is. Presentation. Why does it?
She does. Pretty good.
No. Just tell me to go.
I mean,
Okay, bring it back up front, please. Please welcome the new drug development group.
Hello, everyone. My name is Jerica Croft. My fellow presenters are Lily, Katie, Tyler, Cecilia, and Jared, and we are going to present to you a resolution for issues with new drug development. Now, almost everyone has used some form of drug in their lifetime. In fact, 7 out of 10 Americans use at least one prescription drug, and 85% of all adults use some sort of over-the-counter medication. But before these can reach the hands of consumers, they must go through the drug development cycle. This cycle has been developing for hundreds of years, but there are still many flaws that need to be corrected. These include the extensive amounts of money and time required to produce just one drug, and the more ethical issue which deals with animal testing. Our plan, which involves coupled animal and human tissue testing, private-public partnerships between drug companies, and help from charitable donations, will resolve these pressing issues and help humans get the medication they need in an effective and ethical manner. So there are 2 current initiatives in place that are helping to improve the new pharmaceutical development industry. One of them is the Critical Path Initiative, or CPI, which is run by the FDA. The critical path of a drug begins with the beginning of preclinical trials and also ends when the drug is released to the public. So the average critical path is 9 years per drug right now. CPI is working to reduce that time period and also the cost of drug development by using new tools and applying new current knowledge to the process. The second initiative is QBD, or Quality by Design, which is run by the FDA as well. Right now, the quality of drugs is ensured by testing. So we develop a drug and then we test it on animals. But quality by design has a much more controlled experiment. So, for example, the materials that are used, like to make the drugs, are more researched and understood by the scientists. So we can predict the outcome of the experiment before we actually do it. Both of these reduce the cost and the time involved in developing drugs, and also reduce the number of animals, like lab rats and rabbits, that we have to use to make new pharmaceuticals.
So animal testing is often used to determine the safety and toxicity of a drug before it's released to the public market. This is an extremely controversial topic because there are many ethical concerns that have to do with animal testing. One of which is the fact that animals cannot consent to having these experiments done on them, and the other being that these animals are held in captivity their entire lives and lead a life of pain and suffering, and then are killed after the trial is over when they're no longer needed. So in order for this to be limited as much as possible, more research has to be done into alternative testing methods, such as virtual or synthetic material, or even human tissue testing.
For our proposal, we would like to start using more human tissue cells as to experiment on rather than on actual animals. This will be more accurate than animal tissue in animals because using human cells will be a better representation of what actually goes on in our body, because it is our body. So we are going to also work later through research to do synthetic materials in order to master use it, because it is hard as it at right now to get tissue cells. So if we could make it synthetically, it would be easier and faster.
This technique will be used by public and private drug companies, and that way we will be able to use the combined amount of resources, such as lab spaces, hired researchers, and funding. Now, to be able to use this technique, we will first need to obtain the human tissues through bodies that are donated to science after they pass away, and through human volunteers. This technique will first start on a small scale, such as 3 to 5 public and private January 1st, 2020, so that we will be able to gather the necessary funds and hire the needed researchers to have this technique started. The money that we are asking for you today will go towards funding the lab space, which is $25,000 a year, a part-time and a full-time researcher, which is $140,000 a year, national printing of surveys, which is $110,000 a year, and we will also need to hire a part-time publisher for $30,000 a year to be able to release these surveys. You'll also need to budget in case you need any in-country trips, which are $2,000 each. And in addition, we will set up an account to receive donations. And our goal is to receive $100 a week in donations to amount to $5,200 every year. In order to measure the impact of this technique, which we believe will reduce the animal testing and the costs and the time, we will gather information in 10 years, because that is the average amount of time it takes to produce a drug, to compare the before technique and the after we implement this technique.
With the funding and development of our program, we will be the start to the end of animal testing cruelty. Pharmaceutical companies will no longer have to worry about the ethical concerns surrounding the testing of their product. Instead, they can safely, efficiently, and inexpensively begin developing their own drugs. This will lead to medical advances that are cheaper and faster than ever before, not to mention as effective as the previously developed products. Our group aims to have 10 to 15% increase in the reduction of costs for drug development in the next 2 years. In addition to this goal, we aim by spring of 2020 to be able to eliminate half of the animal testing abuse in the world. Our program will be taking place in the state of Virginia with 3 to 5 local drug development companies. These companies, if successful, will then reach a nationwide level where we will need $300,000 in order to fund our project. So with your help and others, we will be able to reach our goal and hopes for the year of 2020. Before we reach that state, we hope to make very large advancements beforehand. So with your support in the fight against animal testing cruelty and the optimization of drug development for the better future. Thank you.
Yes, what types of human tissue will you be using, and how will, for example, if you're going to be using heart medication, would you only be testing on heart tissue, or would you also be testing the effects of the liver? And how do you plan on testing on all of the different tissue types in the body that can be affected?
Well, we will first start with the bodies that are donated to science, since that is easier to obtain the tissues from. So, because if you have a human volunteer, you don't really want to cut into their heart tissue. So we will first start with the heart tissue and then move to different tissues throughout the body, so that we can see how it affects all of the different types.
But when you get a volunteer that's been donated to medical science, they're no longer alive. So those cells that you're dealing with are no longer alive. And they might act differently on a cell, but it's still living.
And that is why after we use the human tissues, we would then use different, like, we would of course have to use living organisms, but it would also reduce the amount of living organisms that we would have to use, since we would get rid of all of the different chemicals, because we start off on such a large basis. We would be able to cut down the ones that would significantly harm them.
So would actually like neurological and like respiratory?
It's impossible to cut them out completely, as we would need to see how it would affect the entire organism as a whole.
You plan to take more beyond animal cruelty than the drug development itself. Well,
So our proposal, its main purpose is to cut down on the amount of animals that are tested while also reducing the amount of time and money needed to produce the drug. So that is how that ties into our topic of new drug development.
She said, but it was just very quiet, you didn't hear me. Now, we discovered that we're likely to get on the market, so this is an excellent go about trying to reduce.
Very good.
Then we get to fund all that.
Ours is so pretty.
And then you go to jump hymns. Yes, Java Pims. There you go. The fuck is that, young? Turn like, yes I do. I know. What are you doing, silly goof? Waving at the camera. Do it again, I dare you. Oh, whoa! That's illegal. They're gonna watch this and be like, we should kill them.
Yeah, they're gonna watch this and be like,
can I get a... They're gonna be like, can I get a... Mickey School, please? Can I get a... Let me get a... You know...
The correct answer is
Can I get a... 6 minutes, go, please. That's a 16-ounce cone. That's a lot of ice cream. That's enough for 9 children in Africa. Live off of. There's so much fat. Milk, fat and sugar. There's so much fat. Cut it. That's not true. Cut it. Cut him. Cut him. Boy. Gosh.
like 4 names around.
All right, please welcome our final presentation of the day, the complementary and alternative medicine group.
Alternative medicine is a different way to treat patients that do not take the steps of normal conventional medicine. Alternative medicine is being used more and more in place of conventional medicine. This is why we propose alternative directed at hospitals across the United States. Alternative medicine is a natural way of healing that does not involve putting foreign substances into a person's body. It avoids cutting people open through invasive surgery and the harmful side effects that come from those medications in conventional medicine. Alternative medicine is focuses on the body healing itself in a natural process without harming it further. While conventional medicine is still necessary for problems such as viruses and diseases that cannot be taken care of on their own, it can replace the addictive pain medication and surgery that require long recovery time by reducing pain in a simple and non-invasive way. Currently, alternative medicine is lacking in quality research with quantitative data. This is because there's no set way to practice alternative medicine, and most of the results are opinion-based. This makes people skeptical when it comes to using alternative medicine, since it is
unclear whether it truly works. By opening these clinics with higher professionals, it may help solve this problem by producing reliable results. Another problem surrounding alternative medicine is the fact that the government won't pay for it with insurance because those practices are private and unaffiliated with hospitals. If these practices were brought into the hospital, insurance may cover some of these costs, and people will be able to afford it and use it more. Currently, clinics are being constructed in Canadian hospitals with promising results. These favorable outcomes show us that the United States needs to start doing something like this and construct these clinics in major hospitals, beginning with the Brilliant Memorial Hospital in Roanoke. Complementary and alternative medicine, also known as CAM, is a very compelling issue in modern society. Many people don't trust conventional sources of medicine because of its side effects or the chemicals involved in producing it. However, these people don't know where to turn when they need medical treatment. If we were able to make access to this more available, so that you could walk into a hospital and be directed to a practice that would work for you, people would be able to use CAM and take advantage of its benefits. People who do decide to use CAM don't know where to go, but if it were so readily available, such as in a local hospital, you would be able to take advantage of its benefits much more easily and have a better quality of life. We have decided that the best course of action to take to address this issue is to implement alternative medicine in hospitals. Obviously, this is a very broad goal, so we have decided to construct a clinic in the Brilliant Roanoke Memorial Hospital. We chose this hospital because it does not currently offer complementary medicine. It is one of the largest hospitals in the state, and it could realistically implement this clinic. This is an important course of action because it makes complementary medicine a standard option in a safe practice. Sometimes our alternative medicine can be the only option for patients. This is the case when patients' personal beliefs clash with traditional medicine. The focus of alternative medicine on natural methods of healing appeals to people's philosophies and beliefs, and it is wrong for an institution of health to not provide medicine to this demographic. Also, there are ailments that cannot currently be treated by traditional medicine, as well as allergies that could stop a person. This creates a large demand for alternative medicine that it would be immoral for a hospital to not provide a safe practice. This is the most. Also the controlled practice of alternative medicine by certified professionals will provide further research that shows that this type of medicine is reliable. Additionally, as news of this clinic spreads, it will raise awareness of alternative medicine. The most feasible course of action that we considered. First, we found that the establishing of a research facility for alternative medicine is an unachievable goal because it costs too much. While building of a clinic is also expensive, we found that people are more likely to donate to this cause if the goal is understandable. We also evaluated the education of the public about alternative medicine. We found this to be inconceivable because there's not a lot of information available about alternative medicine, and the large-scale spread it would be very difficult. That is how we came to the conclusion that alternative medicine is, that the construction of a clinic is the best course of action. It will provide a safe option for the use of alternative medicine to all the people in the Roanoke area. So we are asking for $250,000 to remodel and renovate the space we are doing at the hospital. Overall, our project is going to end up being around $1,100,000, which we will be gathering from generous donors and applying for other grants. Construction workers, hopefully within the next year after we gather all of our funding, who will renovate and remodel our space at Memorial Hospital. At the latest, our clinic will be open by 2000. Staffing and equipment take up a very large part of our budget. This is because we will be hiring 2 certified nurses and 4 specialists in the field. Practice and naturopathic. These are very high-paying jobs, which is why it is yearly. The equipment is very expensive, such as acupuncture and aromatherapy require very expensive equipment. So in the end, after we constructed our clinic and we have clients, yearly we will be sending out a survey to our staff and to all of the clients in the Roanoke area, seeing how successful our clinic has been and how helpful it is. In conclusion, we are asking for a grant of $250,000 to construct a clinic inside the Cody Roanoke one. This is most financially and most financially responsible decision. This amount of money is one step closer to funding our clinic. We are currently searching for other sources of income through this clinic will provide accessible research, alternative medicine. The professionals who work in this clinic will provide a setting for future funding. Alternative medicine is a simple and easy way to heal religious beliefs, medical fears, and allergies. This clinic will greatly benefit the Roanoke community and areas. We should be funded because those in the standard option. With these new options, patients can explore new benefits.
Okay. So are you pro this, like, or are you pro alternative medicine, or are you just trying to, like, find out if it works? Because you said you don't have much.
We're trying to implement alternative medicine in more people's lives. Not very many people have access to it. It's a very the natural way to heal.
So you're pro alternative. I have, since you answered that, do you have any research that speaks to the efficacy of alternative medicine?
Paper I used a study that talked about the effects of alternative medicine on and it overall drastically improved their quality of life. And it was just used to help let it beneficial.
Okay. Yeah.
There was very few, the FDA does not regulate alternative medicine at all, so they cannot get research grants and funding through many government areas because of these. You say alternative medicine, and I heard you specify chiropractic, the aromatherapy, and acupuncture, but is there also going to be herbalism, and what degree of alternative medicine? There's a lot.
All of you will be in herbalism and aromatherapy, things like essential oils and just natural alternatives to healing. So things such as red raspberry leaf actually helps with body cramps.
Oh yeah, but it's also an abortifacient. It causes abortion.
Sorry, what?
It's an abortifacient. It also causes abortion. So you have to be careful with who you are giving it to. all of the medicines that the hospitals are herbs. They're all herbs. The chemo for childhood leukemia comes from Madagascar periwinkle. They take out the good parts and they get rid of all the toxins and everything else that our bodies can't process. When you use the herbs straight, you take in all of those that might have effects on for example, dandelion is a diuretic. Anything has side effects if you use too much of it, and there's been very little research in alternative medicine, such as herbalism, for this reason. There's really no way to. The biggest one we're doing right now is marijuana. It is the most researched herb right now because of everything that's been going on with our government in Colorado and everything else. But how do you plan with such a broad spectrum of aromatherapy, essential oils, acupuncture, has thousands of years of history and has many studies done. That one's solid. But all of the others have not been even in the early stages of testing. So how do you plan on getting to the point when it takes 15 years to get approved for a medication to where you're actually using these things in a safe, research way?
For practices that have no backing that we can find whatsoever, they will not be offered in the clinic. But for other practices where it's a fine line between, too much having bad effects and having really good effects on the body, that is why we'll be hiring certified practitioners too. To add to that, there are many people who prefer alternative medicine just because that is what their family does. So that's why we're offering it so that they have the options that they prefer.
We're gonna have to call it there since we've got one school that's in a bit of a hurry to get back today, and we've got one other thing to do. Sorry, gonna leave a couple questions hanging. Yeah. You want an email? Email. So, guys, good. Nice job. All right, ladies and gentlemen, we need to do, hey guys, finish up here real quick. We need to do some evaluation on the last group, and then you need to have a couple of minutes of discussion because each group is going to need to deliver about a 30-second what we call elevator speech. Just a recap. What is it? What are you asking? What you're talking? What are you asking for? How much money are you asking for? What do you have to accomplish? Whoever the group decides. One person probably is better, but
I want to do it. I want to do it. I really want to do it. I really want to do it.
Well, we get one call for yeah. I think I like the one with the camera. He's Mr. Carroll. I don't remember. No one touched that. I like genetic testing. Human life extension. That was really good. I think that was
Hey, ladies and gentlemen. The last little bit of commercial, just because it's been a long day, and everybody says, by the way, get